so on. So I think that managing our health from a behavioral aspect is actually really important.
My first question for you, the focus in research in healthcare has traditionally primarily been around finding new drugs, new therapies, and so on. You are very involved in behavioral science and its application to patient support. And my question to you, would you like to see more research in that area as opposed to purely on the clinical side? Do you think that would be of use to patients?
Yes, I do actually, because I think it's really important to get to know and understand each person in order to acknowledge, so they can begin to acknowledge and manage perceptions about themselves and how they manage their health. And as we know, we all tend to deny that we have something wrong with us when that happens in our health. We've got a sudden issue. So that acceptance really is a kind of process, and then we need to get to understand about what can make our body, our mind better, what works for us, what doesn't. I think particularly we see with younger generations also the fact that they're not very recognise the fact that they may be ill or they may have something wrong with them, and they don't want to be stigmatized or feel different, but carry on fitting in, which of course can be a little bit dangerous, because they'll tend to keep at bay something that could be preventative and could actually help them long term in better quality of life and so on. So I think that managing our health from a behavioral aspect is actually really important. It's a big challenge for people to stick to a care regime, stick to their treatment, their medication, take it in the right way, the dose, the technique, and so on. So if we could actually begin to understand a little bit more and help people take those first steps in becoming more active, then issues around our health and our healthcare therapies and treatments. And in that way, we should be able to actually save the system money, use it for when we really need it, not overuse it or misuse it, and keep people safe too, because now, of course, more than ever with the blended care, the home care and the hospital settings, people need to stay away from hospitals and clinical centres. So they've got to become much more competent in managing their care. So I think this is where behavioural science now really is a must.